yeah, between having online access, like the American Urologic Association has a lot of resources on there. And then also like at the hospital, we have conference every week, grand rounds. And luckily now, since the pandemic and everything, we can log in, remotely. So it just makes it even easier than having to be in person. If you're like, maybe if there's mornings where I'm operating that morning, I can't quite get to where the conference is, at the same time, we have remote learning and education as well. So I think that there's a lot of different sources to get information and stay up to date with things. And listen, you have to be, recertified from a board standpoint too. So there's things you do with, maintenance and certification every couple of years that you're having to keep up. But honestly, even just with your medical license, you have to do, CMEs and things like that. So there's a lot of resources to get that these days. Everything is pretty well run. Because we have people that are in place where I can send a text over. I mean, actually, I just did it this morning. I said I needed a certain medication in the office today, and I get a text back like, "Yep, it's there." Like or you need it, it'll be there in a half an hour. So it's actually run very efficiently in terms of getting, getting equipment or getting resources here. Because everything is patient care oriented, and so it's been built up that way. And it seems like a big trope to say that, but this is how it's run. Everything involves around making sure the patient gets care and gets care in a timely manner. So, I've had much of an issue with supply issues. I mean, there's even certain medications that are impossible to get for various reasons, back orders, or they're not, they're not being made as readily available. And we generally can have, we're pretty good about getting these things. And I mean, part of it is, we're a big group. We're part of even a larger group that's an oncology group that helps get these resources in. So I think from that standpoint, it hasn't been much of a challenge for us. Like I think things are pretty well run here, where we can get most of the things that we need and have to have.